Thank you for providing this opportunity to speak. I'm speaking both as a resident and as a trustee on the SD 61 Board of Education. The board sent a letter to all city councils and CRD dated February 11, 2010. The body of the letter reads as follows. On January 18, 2010, the Board of Education passed a motion to inform all city councils and the CRD that we fully support a public water and sewage system. The board wishes to confirm their concerns in relation to the possibility of the privatization of a public water and sewage system. The board does have a vital interest in this issue because we are big consumers of this service. I'm reiterating the information in this letter at this time to make sure that it is not missed, and I've included a copy in the print materials provided to the recording secretary. First, I would like to address the business model being considered for the procurement of the wastewater treatment program for our community. P3s are not the way to go. We need only look across the water to the Olympic Village to see an absolute failure of a P3. This project was originally supposed to provide some affordable housing units. The private developer was in the middle of construction when the economic downturn caused the company to lose bank funding. So the developer cut his losses and dropped the project. The developer had made sure there was a clause in the contract that dumped the responsibilities onto the city and taxpayers. The city was left on the hook with a half-finished project and the Olympics fast approaching. The city had to spend $100 million of taxpayer dollars to finish the project, and the last slap in the face is that huge costs meant there will be no affordable housing. Also, the Royal Jubilee Hospital Tower is another good example of bad P3 outcomes. The CRD identified a need for a minimum of 655 beds in the region. The province insisted that the hospital expansion be done as a P3. When the deal was signed behind closed doors, the project was reduced to 500 beds. So when it's finished, we'll still be 155 beds short of what we needed 5 years ago. Not a good plan for our public health care, but then P3s are not about serving the public good. They are all about finding ways to divert our taxpayer dollars from public services and into private pockets for private profit. In Cranbrook, a P3 to build a recreation complex had to be stopped when the private partner underestimated its operating cost and overestimated its revenues. Cranbrook was left with millions to pay and is now famous for having the highest debt level of any BC municipality. Not something to be proud of. Parks and Terhart, researchers working for Blair McKay Minot Valuations Incorporated of Vancouver, said in a 2009 report that there is a growing body of evidence indicating that P3s are not cost-effective, environmentally sustainable, or socially desirable. Research on P3s show that they generally cost more than traditional public procurement and transfer few risks away from municipalities. When they fail, and an amazing number of them do, communities pay those damages. In this economic climate, private credit is becoming more expensive and difficult to obtain. The economic and financial crisis has made P3 financing much less certain and deals with private partners much more risky and susceptible to default. Public bodies have access to the lowest available borrowing rates. Municipalities can create cost saving by entering into public-public partnerships with other municipalities. Whistler is a model example of one of Canada's most efficient and environmentally sustainable wastewater treatment facilities. At first, it was going to be built using a P3, but after strong public objection, it was built using a public procurement model.
You have 1 minute.
The project was built on budget and ahead of schedule. Privatizing our public services is not the right way to go. It doesn't make sense from an economic viewpoint, nor does it make sense environmentally or socially. Privatized services always end up costing more. We need to remember who we are as Canadians. This country was founded by people who help and support each other. It was built with strong values, the core of which is our belief in a robust public sector able to deliver services to all of its citizens. We stand for public education, public health, and now we are standing for public water and public wastewater treatment. We are not for profit when it comes to our public services. We are for each other, a generous and kind people who value all of our citizens, not just the ones who can pay.
Thank you.